So the name of the project is called the PARC Project, which stands for Positive Advanced Recovery Connections. And I'm a mental health nurse in practice. I went on to train as a registered advanced nurse practitioner. So basically, when you go to do that, you look at the services and you come up with a solution for maybe some gaps in practice. So what I had observed in the service was that a lot of patients were on waiting lists waiting to access interventions. And a lot of patients, I suppose we should be providing most mental health care in primary care. They say, the Department of Health would say 90% of mental health should be dealt with in primary care. So the project, the gap that it identified was to provide interventions to patients from the primary care setting. So I carry out a psychosocial assessment on the patient because a registered advanced nurse practitioner is trained to the level that they can assess, diagnose, prescribe, make onward referral and discharge a patient, providing those full episodes of care. And I'm very lucky to work alongside some amazing mental health nurses who provide the interventions for the patients that they wish to engage in.
Okay, and can you tell me a little bit about what the next steps of the project might be?
Yeah, so the next steps of the project will be, I suppose, to look at how evidence-based it is. So as a registered advanced nurse practitioner, it would be expected that you will provide yearly evaluations on what's been provided to the service user, and how successful has it been both clinically and, I suppose, from the perspective of the patient themselves. So their own personal journey and their personal narrative of how positive the experience was, or maybe in some cases if there was an issue with the experience, and we will catch all of that in the qualitative feedback. So my current work at the moment, I'm completing the evaluation for the second year of the project. I can say that it looks very, very positive, and that the patients have done very, very well, and that they have really enjoyed attending the service.
And you were obviously successful with the Kevin Plunkett Awards.
Yeah.
How will the awards support the project? Is there a particular phase it will support? Is it overall? What's the main support being successful in the awards?
Yeah. I think overall it gives us that little bit more autonomy, because you have a particular set of money that can be invested directly into the project. Some of the things that it will provide is psychology tools, which will allow us access to these fantastic worksheets and I suppose resources that are really, really helpful in providing both CBT and the decider skills. It will also, we have a peer-led art group, and it will also provide the resources for that. There's currently about 6 to 7 people attending weekly, and it will provide the resources to ensure that that can run for another year. And that's really valuable to the people who attend it. And it's to help us to look at the data that we have in that we would have received back in terms of the patient outcomes, and to really work out what's working, what improvements are being made, and how sure we can be that that is because of the intervention we provided, if that makes sense.
And was there any other kind of similar grants or awards that you had applied for, or like why the Kevin Plunkett Award, and where did you hear about it?
Yeah, well, I would have entered the first year of the Kevin Plunkett Award, and we were successful in that year, which was amazing. And at that time, I had heard about it through social media. I had seen it on Twitter, but I also had been emailed by my own nurse management and by the clinical practice development coordinator. So they would have emailed saying, I think this would be really brilliant to enter, because the PARC project is so focused on mental health nursing and what mental health nursing can bring to the mental health setting. It seemed ideal that the Kevin Plunkett Award, and knowing that this was a gentleman who really was passionate about mental health, very passionate about mental health nursing, so it made sense to apply for that award.
Yeah, absolutely. And so what would you say, Anne, to somebody who was thinking of starting something like this and weren't sure where to start, or maybe were a bit kind of concerned that it wouldn't get off the ground, or where to even look for support? What would you say to somebody who might be in the shoes that you were in a while ago?
Yeah, I think the most important thing is to involve as many stakeholders as possible, and that would include both family members, service users, experts, in the area of where you're working and people who you'd be liaising with. So for example, for me, we have a quality improvement group that has family members, service users, people who provide the services, including people outside of the mental health setting, so GPs. And I think the reason I would say to involve all those people is because if you involve them from the start, you'll know if it's going to work or not, if it's going to be something that's acceptable to all the parties who are going to be involved with it. So I would say stick with it, stay basic, keep your plan very, very simplistic and very clear. Don't make it in any way highfalutin, because then other people won't be able to understand what it is. The simpler, the better. And making sure that all stakeholders are involved, I think, is probably the most important thing in terms of getting it off the ground. Because they say, when I was studying to do the advanced practice, they were saying there's like a 17-year gap between findings and being able to implement something. And I think that's because we try to implement things that we haven't involved all of the stakeholders in, so then it's very hard for you to bring something in if you haven't got that buy-in from the very beginning.
And it's the voice of the stakeholders, like you said as well, that will add that richness to your project, or that, you know, that co-production to your project.
Absolutely. They're the ones that are out shouting about the project more than anybody else, actually, because they've been in it and they've received interventions in it, and now they're helping other people in the local recovery committee. So yeah, you can't, having buy-in from all the stakeholders, particularly those who use the services, it just can't be underestimated how important that is.
And thank you so much for your time. It was lovely chatting to you, and congratulations again, and best of luck with the project.
Well, thank you very much, and we'll always keep you updated. We'll let you know what's happening.
Wonderful. Thank you.
Thank you.